My name is Sarah or Sarah Muparutsa. I come from Harare in Zimbabwe. I had about 4 years with the problem of my back. I couldn't walk straight. I had so much pain, especially on my right side. I tried to go to doctors, taking tablets, going to physio, but it didn't help. So eventually I had an appointment with a neurosurgeon in my country, which I did, and after consulting with her, I was told that my back was very bad and I needed surgery. Because all along I thought it was just going to be a normal procedure without surgery. Unfortunately, I couldn't go through with her because of her price. The price was very high. Then my medical aid society sourced, like countries like South Africa and India. And it so happened that when Dr. Anil Raheja received my, I should say it's more like what my problem was, he said he was going to operate on me. And I received a letter from my medical aid society that I was coming to India. I was so thrilled, I was so happy. And I was even given a website which I checked who my doctor is and what Nova does. We were brought here and I only saw Dr. Anil the next morning. He came to see me. He inquired of my problems that I was going through. We went through everything from the year that I started having problems, and he said, "You'll sort me out. There's no problem." That was his his answer to me, and I was confident in him. Yes, then we started having all the tests, the MRIs, the chest x-rays, and also the heart echo. Everything was done, and he said, "I'm happy, I can operate on you." So he also spoke to my daughter, whom I came with, Chidom Parutsa, and he told him of my problem. Then the next morning, which was on the 10th, I went up to the surgery, and I had my spine decompression, as he says. Waking up, I was not very dizzy. It was like nothing happened, but I was weak. I'm happy, I'm well now, I can walk. I'm also having, physiotherapy. But whenever I come to have my dressing changed, Dr. Anil is always there to check how the wound is like before it's closed or before it's cleaned and everything else. Otherwise, I'm very happy with everything. This is my, I was operated on the 10th, my 13th day after the operation. I'm feeling good. I know I'm getting there. It's hard. There's some discomfort with it, but I'm sure I'll be able to be walking straight and well again. I'm very happy to be here. I'm happy with the experience. It was a very good experience, with pain, with patience, with everything, but I'm happy.
Sarah is 59 years old and she's from Zimbabwe. When she came to India to us, we found that she's suffering from a severe lumbar canal stenosis with grade 1 spondylolisthesis. She was operated in 2001 in Zimbabwe when her laminectomy was done. But for a few years she was alright, but then pain started recurring, and now she was complaining of severe pain going down her legs, both the legs, and she was barely able to walk. She was in pain, she was walking with support, her legs were numb, and on evaluation we found that she's having a recurrence of the disease. There was a grade 1 spondylolisthesis as well as compression on both the nerves. Then we evaluated her, we did an MRI, contrast enhanced MRI, and we planned for her surgery. Then we did the surgery in which we did a wide laminectomy. We did a thorough neurolysis of nerves on both the sides, as well as we did a pedicle screw fixation and reduced the listhesis. Previously the listhesis was grade 2. Now the remaining is less than grade 1, means there is only 10% displacement is left, and she is very comfortable now. The pain going down her leg is gone now. There is slight pain in her back, which is because of the surgery, and we hope that she would be fine in another 2 weeks. And now she is walking without any support, and her leg pain is already gone, and her neurological status is becoming better, and we hope that she recovers nicely from this surgery.